Hi everyone, thanks for tuning in to this discussion of tuberculosis in children and adolescents. Yes, today I'm seated here with adolescents. We are going to talk about tuberculosis in children and adolescents. So, here's the deal. In November 2023, the Kenya National TB Program introduced new guidelines for managing TB in children and adolescents. Here we are. Say hi.
Hi.
Thanks for tuning in to this discussion on tuberculosis in kids and teenagers. I want to start by saying hi and giving warm shout out to all of you awesome viewers out there. So, here's the deal. In November 2023, the Kenya National TB Program introduced a new guideline for managing TB in children and adolescents. Today, we are going to dive into the latest development in this field. Let's kick things off by looking at the global impact of TB. According to the World Health Organization, Global TB Report from 2023, first of all, it's important to know that TB is still a major infectious cause of illness worldwide. Before the COVID-19 pandemic, TB was actually the leading single cause of death from an infectious agent. Yes, globally, an estimated 10.6 million people had TB. But only 7.5 million cases were officially reported. And shockingly, around 1.3 million of those affected were children. Out of that number, approximately 900,000 children were diagnosed and reported, making about 12% of all reported TB cases. Here is the really alarming part. 40% of children with TB either went undiagnosed or weren't reported at all. That's a serious problem that we need to address on a global scale. On top of that, it's disheartening to hear that 16% of deaths among individuals with HIV and 18% of deaths among those with HIV were children. However, on a positive note, the treatment success rate for children with TB was 91%. But unfortunately, only one child of eligible child household contact of TB patient received TB preventive therapy. We definitely need to improve in this area of TPT. Now, let's focus on Africa, specifically Kenya, my home country. The WHO reported that between 17,000 to 24,000 children aged 0 to 14 years in Kenya are affected by TB. In the same period, Kenya reported a total of 10,085 TB cases, which is about 50% of the estimated cases. These reported cases accounted for 11% of the total reported TB cases in Kenya, which was around 90,841. Now, let me break down the numbers of childhood TB cases in Kenya. In 2022, there was a total of 10,085 cases reported, with slightly more male, about 52%, than female, which was 48%. Out of these reported cases, children aged 0 to 4 years made up 6,554, giving about 65%. And children younger than 2 years old accounted for 5,005, giving a 76%. Children aged 5 to 9 years represented 1,683 cases, which is around 17% of the total reported cases. Lastly, children aged 10 to 14 years accounted for 1,848 cases, equivalent to 18% of all reported cases. In 2022, The proportion of bacteriologically confirmed TB cases versus those diagnosed clinically was 11 to 89. Most of the reported cases were 84% were pulmonary TB, while the remaining 16% involved other areas of the body, like extrapulmonary TB. The public sector was responsible for 81.2% of reported cases, while private sector and prison healthcare providers contributed 18.6% and 0.2% respectively. Guys, the co-infection rate of TB and HIV in Kenya was 10%, but the uptake of antiretroviral therapy among those with both infection was an impressive 98%. And then, when it comes to nutrition, it's concerning to know that 52% of TB patients were undernourished. 29% suffered from severe malnutrition, and 23% experienced moderate malnutrition. Now, let's take a look at the treatment outcome for drug-susceptible TB in children in 2021 cohort. We see pretty encouraging treatment success rate of 91%. However, among children living with HIV, the rate dropped slightly to 85%. Similarly, those with severe acute malnutrition achieved a treatment success rate of 82%, and those with moderate acute malnutrition had a rate of 83.7%. Guys, the mortality rate among children under the age of 15 with TB was 4.2%. For children living with HIV, the mortality rate varied across age groups. 10% for ages 0 to 4, 6% for ages 5 to 9, and 5.6% for ages 10 to 14. Children suffering from severe malnutrition had mortality rates of 6% for ages 0.4, 5% for ages 5 to 9, 5% for ages 10 to 14 years. Now, let's talk about the pathogenesis of TB in children. TB is a chronic disease caused by a bacterium called Mycobacterium tuberculosis. It is spread when an infected person coughs, breathes, talks, or sneezes, releasing the bacteria into the air. Pulmonary TB affects the lungs, while extrapulmonary TB can affect other parts of the body. Guys, kids usually catch TB from the older contacts, like teenagers and adults. Younger children don't spread the disease as much as because they have fewer bacteria and weaker coughs compared to adults. However, older children with smear-positive and cavitary TB are just as infectious as adults. It's important to recognize that when we see TB in children, it often indicates that there has been recent or ongoing transmission of the disease within the community. Now, let's take a closer look at the different phases of TB progression in children. Let's look at phase 1. Within 3 to 8 weeks after infection, a granuloma forms in the outer part of the lungs. This granuloma is filled with bacteria, which then move through the lymphatic systems to the hilar lymph nodes. That's actually near the lungs. During this phase, there might be fever, skin redness, that is erythema nodosum, positive tuberculin test, or interferon gamma release assay, and a visible primary complex on a chest X-ray. Kids might have mild symptoms like low-grade fever, poor weight gain, tiredness, and no initial respiratory signs. Let's look at phase 2. This phase happens about 1 to 3 months after infection. And TB spread to the bronchial and lung tissues, causing TB pneumonia. Sometimes it can even reach the space around the lungs, known as pleural effusion. The bacteria can also travel through the lymphatics and blood systems to other parts of the body, especially the brain meninges, or in tiny spots all over, giving miliary picture. At this stage, kids might have symptoms such as weight loss or poor weight gain, fever, rapid breathing, trouble eating, tiredness, and just overall looking sick child. Meningitis and other lung symptoms might require kids to stay in the hospital. Also, around 70% of kids in this phase will have a positive Mantoux test. That is a test for TB. I want us to look at the next phase of phase 3. This phase occurs 3 to 7 months after infection. Kids over 5 years old might develop pleural effusion, fluid around the lungs, while younger children usually have bronchial disease. Guys, let's look at phase 4. It's usually seen 1 to 3 years after infection. This phase might show the calcification, that is hardening of the corn foci. That's an area of infection. Kids under 5 years old might develop tuberculosis in their joints or bones. The risk of disease progression after initial infection is much lower at this point. Sometimes kids might develop adult type TB later on, usually in their teenage years after calcification has happened. What about phase 5? This phase appears more than 3 years after infection and includes late TB manifestation. For example, kids might experience reactivation of pulmonary TB after calcification has occurred. My people, to wrap things up, TB in children and adolescents is a big problem all around the world. It's crucial that we make a dedicated effort to identify, diagnose, and treat these cases better. With increased awareness, strong healthcare systems, and collaboration, we can work towards reducing the impact of TB on this vulnerable population. Thanks for joining me in this informative discussion. In our next topic, we are going to look at short-term TB drug management in children and adolescents. Kindly follow me, subscribe, like, and share at Nandi Empress. Thank you so much.